https://youtube.com/@medicine727 A stillbirth is the death of a fetus in the uterus after week 20 of pregnancy. The fetus may have died in the uterus weeks or hours before labor. 1. Early stillbirth. The fetus dies between 20 and 27 weeks. 2. Late stillbirth. The fetus dies between 28 and 36 weeks. 3. Term stillbirth. The fetus dies the 37th week or after. Risk of having a stillbirth. You're more likely to have a stillbirth if you smoke, drink alcohol, or use recreational drugs, are over the age of 35, have poor prenatal care, are malnourished, are having multiple births, twins or more, have a pre-existing health condition, have obesity, body mass index above 30, causes a stillbirth. The cause is not always known. 1 in 3 stillbirths cannot be explained, but the most likely causes include 1. Problems with the placenta and/or the umbilical cord. Your placenta is an organ that lines your uterus when you're pregnant. Through it and the umbilical cord, the fetus gets blood, oxygen and nutrients. Any problems with your placenta or umbilical cord and the fetus will not develop properly. 2. Preeclampsia. Preeclampsia is high blood pressure and swelling that often happens late in pregnancy. If you have preeclampsia, you have twice the risk of placental abruption or stillbirth. 3. Lupus. A person who has lupus is at risk of having a stillbirth. 4. Clotting disorders. A person with a blood clotting disorder like hemophilia is at a high risk. 5. The pregnant person's medical conditions. Other illnesses can sometimes cause stillbirths. The list includes diabetes, heart disease, thyroid disease, or a viral or bacterial infection. 6. Lifestyle. If your lifestyle includes drinking, using recreational drugs and/or smoking, you're more likely to have a stillbirth. 7. Birth defects. 1 or more birth defects cause about 25% of stillbirths. Birth defects are rarely discovered without a thorough examination of the fetus, including an autopsy. 8. Infection. An infection between week 24 and week 27 can cause fetal death. Usually, it's a bacterial infection that travels from your vagina to your uterus. Common bacteria include Group B Streptococcus, E. coli, Klebsiella, Enterococcus, Haemophilus influenza, chlamydia and mycoplasma or ureaplasma. Additional problems include rubella, the flu, herpes, Lyme disease and malaria, among others. Some infections go unnoticed until there are serious complications. 9. Trauma. Trauma such as a car crash can result in a stillbirth. 10. Intrahepatic cholestasis of pregnancy, ICP. Also known as obstetric cholestasis. This is a liver disorder that includes severe itching. Diagnosis. Blood tests. Blood tests will show if you have preeclampsia, obstetric cholestasis or diabetes. Examination of the umbilical cord, membranes and placenta. These tissues attach to your fetus. An abnormality could prevent the fetus from receiving oxygen, blood and nutrients. Tests for infection. Healthcare providers will take a sample of your urine, blood, or cells from your vagina or cervix to test for infection. Thyroid function test. This test will determine if there's something wrong with your thyroid gland. Genetic tests. Your healthcare provider will take a sample of the umbilical cord to determine if the fetus had genetic problems such as Down syndrome. Precautions. Avoid recreational drugs, smoking and drinking alcohol. Contact your healthcare provider if there's any bleeding during the second half of your pregnancy. Do what's called a daily kick count. Around 26 to 28 weeks, familiarize yourself with fetal movements. Figure out what's normal for the fetus. Then, if they stop acting normally, contact your healthcare provider. Before you get pregnant, work toward a weight that's healthy for you. If you're already pregnant, talk with your healthcare provider about diet and exercise options. Protect yourself against infections. Avoid certain foods including some types of fish and some types of cheese. Also, double-check to make sure that any meat or poultry you eat is thoroughly cooked. Report any stomach pain, itching, or vaginal bleeding immediately. Sleep on your side, not your back. If you've been pregnant for 28 weeks or more, sleeping on your back can double the risk of stillbirth. It's not completely clear why that makes a difference, but experts suspect that it has something to do with the flow of blood and oxygen to the fetus. Get routine tests, including your blood pressure and urine. These will help your healthcare provider see if there are any illnesses or conditions that may affect the health of your baby.